Hello everyone, I'm Preeta from Group 25. Today I'll be demonstrating and also explaining the skills of estimating and grading a pitting edema. Hello Miss Shrila, I'm Preeta, your nursing assistant. How are you? That's great. You were complaining both of your feet was swollen, right? So don't worry, I'll check it for you. My first question is, what is an edema? An edema is swelling that is caused by fluid trapped in your body's tissues. Edema mostly happens in feet, ankles and legs but can affect other parts of the body such as face, hands and abdomen. It can also involve the entire body. There are many types of edema. Each one can indicate a range of further health conditions. So the first one is peripheral edema. This affects the feet, ankles, legs, hands and arms. Symptoms include swelling, puffiness and difficulty moving certain parts of the body. The second one is pulmonary edema. This occurs when excess fluid collects in the lungs, making breathing difficult. This can result from congestive heart failure or acute lung injury. It's a serious condition. It can be a medical emergency and it can lead to a respiratory failure and death. The third one is cerebral edema. This occurs in the brain. It can happen for a range of reasons, many of which are potentially life-threatening. The symptoms include headache, neck pain or stiffness, whole or partial vision loss, changes in consciousness or mental state, nausea, vomiting and dizziness. The next one is macular edema. This is a very serious complication of diabetic retinopathy. Swelling occurs in the macula, which is the part of the eye that enables detailed central vision. The person may notice changes in the central vision and how they see the colors. For pitting edema with this type, which can occur in peripheral edema, pressure is applied to the skin, leaves an indent or pit in the skin. For periorbital edema, this refers to an inflammation and puffiness around the eye or eyes. The puffiness is due to fluid buildup and usually temporary. Edema can occur in other locations as well, but those four types that I mentioned are the most common ones. This edema can indicate one of many serious health conditions, and it's important for a person to check with the doctor if they are concerned about any kind of swelling. So what are the causes of edema? Edema can result from circulatory problems, infection, tissue death, malnutrition, total body fluid overload and electrolyte problems. There are many other possible causes for edema such as heart failure, kidney disease or kidney damage and liver disease. Now I will demonstrate grading a pitting edema. The pitting edema has a grading scale and it's ranked on a scale of 1 to 4. We will start from 0 plus pitting edema. 0 plus means there is no edema at all. This is 1 plus pitting edema. It's also known as slight pitting edema. It's very difficult to see and it's approximately 2 mm indentation. It disappears almost immediately right after your finger is removed. This is 2 plus pitting edema. It's also known as mild pitting edema. It has approximately 4 mm indentation and this appears in 10 to 25 seconds right after your finger is removed. Next is 3 plus pitting edema. It's called moderate pitting edema. It has between 4 to 6 mm indentation and lasts for a significant amount of time. It takes more than 1 minute to disappear after your finger is removed. The last one is 4 plus pitting edema. It's called severe pitting edema. It has more than 6 mm indentation and it lasts for a longer time. It can even take several minutes to be normal after your finger is removed. That's all for today. I had to demonstrate this topic using pictures as I don't have edema patients at home. Thank you so much for listening.